There is one type of medication people take year after year without ever really knowing whether it is right for their symptoms, how long it needs to work, or whether they are treating the right problem at all. This is allergy medicine. Maybe it is the pill your parents always kept in the cabinet. Maybe it's the brand you recognize at the pharmacy. Maybe someone once told you to try a nasal spray, so you just used it for a few days and decided it did not work. And every year, when the headaches, congestion, itchy eyes, and runny nose come back, you reach for the same thing again. Maybe it helps just enough that you keep buying it, but not enough that you actually feel well. You are still waking up, unable to breathe through your nose. You are still going through boxes of tissues, struggling to focus, and dragging yourself through the day in a fog. But because it's just allergies, you assume there is something you have to put up with. What most people never stop to ask is whether their allergy routine was ever designed for the symptoms they actually have, or whether those symptoms are being caused by allergies at all. Because when the same routine fails year after year, the answer may not be stronger medication. It may be better diagnosis and a better strategy. Welcome back to the Resilience Factor. I'm your host, Dr. Pamela Mehta, and today we're talking about why common allergy treatments so often seem so ineffective and how to stop relying on the same trial and error routine year after year. I'm joined by Dr. Payel Gupta, a triple board-certified allergist and immunologist who treats both adults and children. She is the founder of Ease Allergy and co-host of the Itch podcast, where she translates allergy science into practical answers patients can actually use. All right, Dr. Gupta. So when a patient comes to you and says, I've tried everything and nothing works for me, what is the first thing that you look for? What is the first thing that you talk to them about? What is your approach?
So, are we talking food allergy? Are we talking environmental allergy?
Let's talk about environmental allergies first,
Yes.
because there's so many, obviously.
Yes. We, as allergists, we literally treat patients from head to toe. So we have so many conditions. We're almost like the family practice of specialty.
Yes,
And
absolutely.
so, when a patient comes in with environmental allergies, they usually have tried everything, right? Because a lot of the medications are over the counter. So a lot of the medications that we have for allergic rhinitis, allergic conjunctivitis, they're all found in the pharmacy. So people will go into the pharmacy and they'll pick up everything that says runny nose, congestion. And unfortunately, a lot of times they're even using antihistamines 2 or 3 times, because one says, for congestion, one says for runny nose, one says for sneezing, the way that they market them.
Sure.
So then
They're
get
like, I
super
have all of
confused.
those.
Right.
Yeah.
Exactly. Let me take one of each.
Yeah.
Right. And so there's a lot of dissecting. What have you tried? What is at home? And then really a big part of my job is helping people understand how to use their medications correctly. And then of course we try to help them figure out what exactly is causing their symptoms with allergy testing.
Okay. And then usually when you say that you're helping them with their medicines, is it that they're like using too many products at once? Is it that they're not using them at the right time? Are they not using them continuously enough? What is the most common mistake?
All of the above.
All
To be honest with you, sometimes they're overusing medication, the same ingredient, the same, an antihistamine 3 times. Usually what happens is people like nasal sprays are the number one medication that we use for nasal congestion, runny nose, those kind of things. And a lot of people will try it for like a day or two and say, oh, this isn't working. But as you know, most of those the spray that we use is a steroid spray, and that takes time to work, right? So it's an anti-inflammatory, and you have to use it for at least 2 weeks before it's making a concrete difference in your symptoms.
Okay, and when we started, you mentioned food allergies versus environmental.
Mhm.
What can the patient themselves kind of point to, like, oh, I think this is environmental?
Yeah. So symptoms of runny nose, itchy eyes, congestion, coughing because of the postnasal drip. So you'll have all of these symptoms and they'll come and go, right? So they can be periodic or they can be continuous. So some people can have perennial allergies or some people can have seasonal allergies. So every spring, for example, people will say, my symptoms start, and then we know that that's a tree allergy, right? And there are certain clues like spring is trees, grass is in the summer, and fall is weed allergies. And then if you're having year-round allergies, that could be to dust mite, it could be to cockroaches in New York City, it
Oh,
could be
gosh, yeah.
to your pet, right? And a lot of people want to not admit to possibly being allergic to their pet. So that's the hardest one to diagnose is when someone's allergic to their pet.
And what is it that's making it so that there was a change? Like maybe they've not changed anything about their environment or their pet or their laundry detergent or whatever. What is happening in the body that is triggering something new for them?
Yeah, so you can develop allergies at any point in your life. And to be honest, now that we're kind of traveling nomadic kind of people, when you move somewhere new, you can get sensitized to your new environment, right? So the pollen that exists in California is much different to the pollen that we have in New York City. So you can go to a new city, you move there. The first season, you might be fine, but the next season, you might start reacting. Allergies can develop at any time. And unfortunately, because of global warming, and because of all the changes that we're seeing in the environment, we are seeing higher pollen counts, more allergies, right? And so more people are getting sensitized.
What do you see in the future? Like, what do you see happening? Like you just mentioned global warming. So, what are you seeing that's going to happen for people?
Job security. Everyone's going to have allergies. Unfortunately, I feel that environmental allergies are not going anywhere, unfortunately, because again, the pollen counts are getting higher because the best way I know how to explain it is that the increased CO2 levels make the plants feel like they're going to become extinct. And how do plants regenerate themselves? They release pollen, right? So they just release more and more pollen, hoping that they'll continue to thrive and survive.
And so, is it with this happening, is there newer technology in the allergy world of what people can do so that they're not having to like take a pill or a nasal spray every single day? Or are we still not there yet?
Allergy immunotherapy is something that we've been doing for a long time. We have available as shots, injections that you can get in the clinic, right? But then there's also sublingual immunotherapy tablets, which are relatively newer. Unfortunately, like in the US, they're only approved for dust mite, ragweed, and grass. So they do exist for tree pollen, but it's not approved yet in the US. And so those are kind of the two things that we can do to really try to mitigate and get rid of these allergies. And it's not a cure, right? So I don't want to say get rid. It just helps to improve your symptoms and make you less allergic to these things to the point where you are pretty asymptomatic and you do feel like you've been cured. But I think that is the one thing that if people are really suffering, if they feel like they do have year-round symptoms and unfortunately even seasonal symptoms, like even if someone's just allergic to seasonal things like trees, grasses, and
Mhm.
weeds, because the seasons are getting longer, those symptoms can start like end of January and continue until the end of November, right? So
I
our
know, it feels
seasons
like
are
the
just
whole year.
yeah, it's basically the whole year. So, even seasonal allergies are not seasonal anymore. It just feels like they're year round. So, a lot of people are kind of shifting and wanting to do some sort of immunotherapy for their allergies, for their environmental allergies. But this is the one area that I think we can get some more innovation
Sure.
happening. Some people are looking at intralymphatic immunotherapy where you don't have to get as many doses because it's going into the lymphatic system. It's working quicker, longer. But that's still kind of in the works and still being researched.
So the injectables that you were talking about, how often are people having to get those?
So it starts at weekly. So when we're first giving allergy shots, we have to bring the patient in weekly and we slowly increase the dose that they're on. And that can expand from 6 to 9 months where they're getting weekly shots. And then they go to essentially every 2 weeks, 3 weeks, and then every month. And we recommend continuing shots monthly for at least 3 to 5 years to really get your immune system to change what it's doing. So it is,
Wow.
yeah, it's a significant time commitment, but people that really suffer from, environmental allergies find that they have to do something. Otherwise, they are, on a daily
Miserable.
basis miserable. Yeah.
Yeah. Okay, let's talk about eczema a little bit. So, is it the same environmental triggers? Is it something different? Is there an autoimmune component to it? Tell us a little bit about that.
Eczema is essentially a dry skin condition, okay? And our skin is the first barrier that we have. It's the most important barrier, I think, that we really do have. And when that's compromised because of the itchy, dry skin, when you have that itch, you're going to scratch it. So we call it the itch that rashes, okay? And so it really starts with that itch. And when you get that itch, then you scratch it and then you get the rash, okay? And essentially that leads to a compromised skin barrier. And when you have that compromised skin barrier, what we know, especially in infants with early eczema, is that it's really important to keep that barrier intact, because if we don't, then environmental things like food and environmental triggers can get exposed through that not so great skin barrier. And if you're picking up your child and you've just eaten a peanut butter sandwich and their skin, they have eczema and it's not controlled, then that peanut can get exposed through the skin as opposed to getting exposed through the oral, right,
Oh,
route.
interesting.
And so the immune system in an infant is still trying to figure out what is good, what is bad. And so it sees this peanut coming in through the skin. It's like, this must be bad. And so that is where we see that we have a higher incidence of food allergy in those children. And so it's really important. And I really want to, tell parents this. It's really important to treat eczema because of that. Some people will be like, I mean, it doesn't seem to bother him, and I don't want to give, I don't want to use topical steroids. I don't really want to give any medications. And I get that, right? You're
Yeah.
a parent, I'm a parent. We really don't want to give our
Especially when they're so young.
yeah,
But it's more
exactly.
protective to do it, is
But
what
it's
you're
more
saying.
protective to do it. Yeah.
So what's the first line of treatment for eczema in children?
So it's a mild topical steroid. There's also some non-steroidals that are getting approved in lower and lower age groups, but it's mostly topical agents. Yes.
Okay.
Mhm.
And you said you've seen an increase in environmental allergies, obviously, because of the environment, global warming. What about food allergies? Are you seeing there be an uptick in that? Are we handling it, managing it better? What are you seeing?
Yeah. So food allergies in general were increasing, right? There was this huge, like, oh my gosh, what's going on? Why? Because when me and you were little, we
Yeah.
didn't have any friends with food allergies,
No.
really, right?
Everybody could
But
eat
now,
peanuts.
exactly. But that was our staple, right, food
Yeah.
to take to
Yeah.
school.
Peanut butter and jelly sandwich. Not
Exactly.
anymore.
And not anymore, right? And so there was this huge, like, what's going on? And then we really, that's when we did there were some pivotal studies in the allergy field, like the LEAP study, that really showed that when you're exposed to peanut early in life, then you have a less chance of developing peanut allergy in the future. And so what we're doing now is we're recommending early exposure to early introduction to all of the food allergens. So things like peanuts, tree nuts, egg, milk, oat, and soy, and shellfish and fish. We're recommending, and sesame, we're recommending early introduction to all of those foods as soon as your baby is ready to eat those foods. And that is essentially serving as a way to and through the oral mucosa, right? And
Sure.
so it's letting your body know that these are all good things, that they're all normal, that they should be consumed. And so the earlier you start these foods, the less likely you are to have developed food allergy.
Okay. So what does early mean? We're talking like 9 months?
3 to 4 months.
Really?
As
Oh my
early
gosh.
as your
It's been a
child's
while
ready.
since my kids were babies.
Yeah, no, I mean, most kids are ready around 4 to 6 months, and
Okay.
probably closer to 5 to 6 months, right? But if your child is showing signs of readiness, then you could start that early. So I've already fed my 5-month-old egg and peanut.
Okay.
So he just turned 5 months
Yes.
yesterday, but I've already started that introduction because I know how important it is.
Okay. And so for when you have a allergy reaction, when are you starting the exposure therapy also that you're talking about? So and I'm going to speak from an orthopedic surgeon point of view that I don't know this stuff at all.
Yeah.
But you hear about these kids that have these peanut allergies, but then they go through these rigorous cycles of taking some peanut in to sort of expose the body. Can you talk us through that? So if you find out your child has a peanut allergy,
Mhm.
what are the options there?
So that's called oral immunotherapy.
Okay.
And what that is it's giving the child small amounts of peanut. Like I'm talking very, very, if they're truly allergic to peanut and when we're going to do oral immunotherapy, we start with very, very small amounts of peanut and we slowly increase that amount of peanut as they develop a tolerance to it. Okay. And so it's similar to the immunotherapy that we were talking about with environmental allergens, but it's just in the form of giving food. That is not for every parent. It's not for every family. It's not for every child, right? And so it is a pretty rigorous protocol. You have to be ready to make sure that you're really on top of it. So if you have like 5 children and each of them has different allergens,
Must be
that might
difficult.
be, it might not be possible to do oral immunotherapy. But depending on the support that you have, it is, it's just really important to really think about why are we doing this and what is the end goal, right? And so what we know now is that for infants, for example, I always recommend that we have that discussion about oral immunotherapy or not, because in that infant age group, their immune system is still very malleable. So there is a chance that we can take that infant and bring them to that state of essentially being not allergic. I don't want to say cure because we're not really ready to say cure, but we can almost cure them of their allergy if we start early enough in infancy. As that child gets older, once they're adolescents to young adults to adults, then the immune system is already pretty locked in. And oral immunotherapy is going to help you increase the threshold, which means that if you're at a Thai restaurant and someone uses the same ladle and you have trace contamination with peanut, hopefully we can increase your threshold that trace amounts of peanut won't cause a reaction, right?
Yes.
So you can tolerate maybe half a peanut or a whole peanut before you're going to truly start reacting. That does not mean that patient can then start just eating peanut left and right. They will be on their peanut dose on a daily basis, but they still are practicing avoidance, and they're still carrying around their epinephrine device. So it's a very, again, nuanced conversation that we have to sit with the family, we have to sit with the patient and understand what their goals are. We also have a biologic now called omalizumab, Xolair, which has been around for a long time. It's actually one of the first biologics that was approved in our field, and it was approved in asthma. It's also approved in chronic spontaneous urticaria, and now also for food allergy. And essentially, it's a great option for any patient with food allergy,
Okay.
depending on what their goal is. Okay. But Xolair is an injectable, so you do have to take it regularly. And what it's going to do is it's also going to increase the threshold that's required to cause a reaction. So you're not going to be able to eat the food. It's not a cure for your food allergy. But if you're the kind of person that reacts to trace amounts of your food allergen and you're always reacting and you're unable to have a life where you feel free to like
Sure.
go
Yeah.
out or do any of these things, then Xolair can be really a great option. Some some allergists are also using omalizumab with oral immunotherapy. So there's also some protocols that involve using the omalizumab to help the oral immunotherapy go faster. So there's a lot of different protocols, and it really just depends on the patient and the family's ultimate goal of what they're really looking to achieve. And just we have to talk about this in practical goals and like what we're actually able to do at this point.
You mentioned the immune system being more malleable when you're younger versus older. Is
Mhm.
there like an age cutoff that you look at a patient or family as like, this is not going to work because
So that's
we've sort
still
of passed that mark?
no, it's still TBD,
Okay.
meaning that the younger the better. But I don't think that right now I could tell you that we have an exact age cutoff of now it's too late, right?
Okay.
I don't think we exactly know that. But the older a child gets, that's when we then start worrying that it can increase their threshold and they will have to continue that dose. So that's the key thing, with oral immunotherapy is you are going to be on that dose that you reach on a daily basis. So it's kind
So
of
if
like
you're
your
eating
medicine.
peanuts, you kind of have to do that like
Yeah,
every single day.
every single day. And if you miss a dose, then you have a higher risk of potentially having a reaction.
That is tough, actually, like you said. In
Yeah.
some families, that's just not possible or
Yeah.
life circumstances.
Yeah. And getting to that threshold, also there can be reactions in between. So again, it a lot of people do it and a lot of people are successful and it's great for increasing the threshold. It's great for families that have really been living with a lot of anxiety. And so I think that there's definitely a place for it, but it definitely takes a motivated family.
And then I've only heard of peanuts as an oral immunotherapy. Are you doing it with other foods as well? What
Yeah.
other foods? What
You
are the
can
common foods?
literally do it with any other food. So we can do it with eggs, we can do it with milk, we can do it with sesame, we can do it with all the tree nuts. And so you can do it with any food that someone's allergic to.
And are you seeing your allergist quite often? Is there a special coordinator that's helping with this? How is this being done,
Yeah.
practically speaking?
Yeah. So, at my office, I'm not currently doing it because I have a mini practice.
Sure.
But there are centers that now are doing just essentially they're specialized in food oral immunotherapy. And so they have really a team of people that's surrounding you and helping you through the protocols and making sure that if you have a reaction, if your child has a reaction, that there's somebody that you can call and reach out to and figure out what are the next steps? What am I going to do? But yes, you are seeing your allergist often. You're getting updosed, right? You're getting the next dose of the peanut or whatever food you're doing the oral immunotherapy to. So yes, there is. It's definitely a huge process, and you're definitely being handheld.
And I imagine there's a mental component to all of this as well. What are you seeing as allergies are increasing amongst, the adult and children population in terms of people's mental health? And how are you kind of guiding or managing them through that?
Speaking on food allergy in particular, I think that people that don't have food allergies really have a hard time understanding what that really looks like for families and for young adults or adults that have food allergy. This is not just my stomach hurts, I just don't like it. This is a life-threatening reaction, right? And so you can be exposed to that food and you can have anaphylaxis, which is life-threatening. And unfortunately, people have died from their food allergies, and that's not completely uncommon, unfortunately, right? So,
Yeah.
from accidental exposures, no one ever eats their allergen on purpose, but it does happen, right? Things are mislabeled, things aren't labeled at all. There is so much anxiety around that. And for families that have a food allergic child, it totally changes the way that they do everything. And so, I think that as a community, as like a whole, we really need to appreciate how much people are dealing with when they have a food allergy themselves or when they have a child with food allergy. I think we need to be much more supportive and much more empathetic. And I think that from the stories that I hear from my patients, a lot of times that's missing, right? And so, if that's one message I can give to everyone, be more understanding. If you're throwing a birthday party, put it out there. Does anybody have allergies? And be accommodating. That child with that food allergy always feels left out. They always feel like they
Yeah.
can't participate. And I think when you don't have that child with a food allergy, you don't always know that, and it's not the other parent's fault or anyone's real fault, but it's just being aware of that. And especially because they're so common, understanding that.
No, absolutely. I couldn't agree with you more on being more empathic towards those families because I do think, it, especially in maybe that boomer generation and the South Asian, I can speak for myself and my family, like
Yeah.
it just was not heard of in the 80s and 90s. And so people have a hard time understanding it even. Like
Yes.
if this is a serious thing, like you cannot have peanuts in the sauce for a birthday party or something.
Yes, we actually have special, like, appointments just with the grandparents sometimes, right? Just, especially if grandparents are helping to
Yeah,
caretake. I will often tell families to bring the grandparents so that they can talk to me personally and understand from me as a
that's
doctor
so great.
that there is a real risk here and that they really, really need to be vigilant about this and how important it is. So, absolutely. I think we're much better now than we were, um, 5 years ago, 10 years ago, 15 years ago.
Right. Because more and more
That
people have them also,
because more
probably,
and more people have
unfortunately.
them, yes, and there's more protocols in place, so it is definitely easier to have a food allergy now than it ever was.
So switching gears a little bit, what commonly gets mistaken for allergies? So, and how can the pattern look different? So, we use this word allergy as kind of a catch-all, and it's kind of one of
Mhm.
the first things we think, oh, maybe you're having an allergy or you're having allergies. What are the other things that it could be instead?
So, allergy is a general term. So, we talked
Yeah.
about food allergy, we talked about environmental allergies, and they all have different symptoms, right? So, a food allergy will be more of, if a person's truly has a food allergy, they will have the hives, nausea, vomiting, shortness of breath, wheezing, chest tightness, all of that stuff, right? And we talked about the environmental allergies. So those are all the classic symptoms. But things that can mimic allergies. So there's also a condition that we treat as allergists called chronic spontaneous urticaria. This is a condition where people just have hives, okay? So they don't have any of the other symptoms. They may have swelling, so it's hives and angioedema. So angioedema means swelling, deeper swelling of the tissue. That condition, oftentimes people are looking for what is the allergic cause? What is the thing that's causing these hives? But it's actually internal. And that you can consider it to be almost like an autoimmune process where the body's mast cells are releasing contents, which include histamine, which causes the hives, inappropriately. You could be in a bubble, not eating anything, not exposed to anything environmentally, and your body will still produce hives. So that's really hard for people to understand. It's really hard for some of our colleagues, like ER physicians and, primary care physicians will tell people that this must be an allergy. And so people either get tested when they shouldn't. So I want to bring that up because food allergy testing should only be done by an allergist.
Why is this?
Reason that is because there can be a lot of false positive test results. Okay. So if you send if you send 100 people that really shouldn't be tested for food allergies, a lot of them will have positive results on their blood tests.
Sure.
If you do a huge panel of foods, right? Then all of a sudden the person's like, they're having hives and then they get this huge panel of foods done and a bunch of them erroneously pop up. Then they're avoiding all of these foods. And as we discussed, having a food allergy is very anxiety provoking, right?
Sure.
So instead of something which is eating becoming like a process that's full of joy, right? Food is supposed to be a community event. It's supposed to be something that we just enjoy that helps us sustain ourselves, right? To live a healthy life. But when we put anxiety around that, when all of a sudden you're at the restaurant with a bunch of friends and you're looking at the menu and you're like, everything on
I
this
can't eat
list,
any of
I can't
this.
eat anything. What am I going to do? That causes so much discomfort and poor quality of life for people. And so I've had people come in that have lost so much weight because they're basically avoiding everything because they were tested by somebody and told that they're allergic to everything. But in fact, they have chronic spontaneous urticaria and it's an internal process, has nothing
It's
to
not
do
related to any of those
with the
foods that
foods
they've
that they're
been scared to
eating.
eat.
Exactly.
Oh, it's
And so
horrible.
yeah, and there's also this IgG testing for foods that people are doing, which also comes back with everything positive. So do not get online food allergy testing is my message to
Okay.
everyone.
That's great to hear because I know there's a lot of non-allergists, not even MDs, DOs, that,
Mhm.
it's a marketing tactic. Come in and get your allergies tested here.
Yeah,
And so be very wary of that is what
yeah,
you're saying.
exactly.
Okay, we talked about over-the-counter allergy pills and
Mm.
taking them all at the wrong time or not enough of them or, not taking them for a long enough period of time. In the simplest way, without giving medical advice, what is your favorite allergy pill that's over the counter? Um, and what's your recommendation in terms of like when it's time to go see a doctor or okay, this is just fine, you can do this.
So I don't have a favorite.
Okay.
I do think that I'm an options girl. I think that it's great in medicine that we have all of these options because it's not a one size fits all, right? And so the more options we have, the better I think we are for patients. But I would say that, as I mentioned, the nose is the key for environmental allergies, at least. And so if there's one medication that you're going to use for your environmental allergies, if you've got the congestion runny nose, it would be a nasal spray and it would be a steroid nasal spray. And again, I don't have necessarily a favorite one, whichever one you can get that's reasonably priced and that you're willing to take and use, that's my favorite for you.
More than Zyrtec or Allegra or any of those pills.
Exactly.
Okay.
Yeah.
Because you're
Yeah.
blocking the
For if your primary symptom is congestion of the nose. Now,
Okay.
if you're getting hives, then so if hives is your primary complaint, then you have to use an antihistamine.
Sure.
So then antihistamine is the only medication that's going to work for you. So it really depends on what your symptoms are and what we're trying to control.
And since we're talking about over-the-counter medicines,
Mhm.
why have allergists moved from Benadryl as an everyday allergy solution? What's wrong with that
Yeah.
line of thinking?
So Benadryl is what we call a first generation antihistamine. So it's
Okay.
an older antihistamine and there's more side effects. Okay. So there's more sedation, there's more anticholinergic side effects. And so we know that it's just more unsafe. Whereas the main thing that we're really hoping to do is get that antihistamine effect, right? And so the second generation antihistamines have fewer side effects. And the antihistamine, that property of it is equivalent to Benadryl, right? So you're not getting more antihistamine with Benadryl. You are getting less side effects with the second generation antihistamine. So, like you said, that's like the Zyrtec, Allegra, loratadine or Claritin, Xyzal, those kind of medications.
And then when is the time to stop over experimenting with these over the counter allergy products and actually go see an allergist? And when should you see an allergist versus seeing your PCP or an ENT or anything like that?
Yeah, I think that if you've been in this cycle of not feeling like you're getting the right therapy and that it is reducing your quality of life, you're not going outside, you're not doing the activities that you want to be doing, it's definitely time to go and see an allergist because we really can help. Number one, figure out what's causing your symptoms, help you do some environmental measures that may help, and then, of course, start you on the right treatment.
I want to shift gears. You took a sabbatical very early in your career
Mhm.
and you volunteered in Nepal, India, some other places. Tell me what you learned from those experiences and your global health work and how you carry this into your practice here.
Yeah, so I was in Liberia
Mhm.
before Ebola, right before Ebola. I was in Nepal right before the earthquake. And then I was in India. And then I was able to travel through Southeast Asia during that time too. It was roughly around like 18 months of my life. And it was the best experience. I would highly recommend to anyone to take that leap of faith. It was really after I'd finished my fellowship. I was still single, but everyone was kind of looking at me like, Pal, you're finally going to be able to make money, get a job, go and work. But I knew it was like this one opportunity for me to really go out and experience global health, which is something that I really loved. And I just wanted to have that experience, before I settled down. And,
Sure.
you know, and I would say that the biggest message I got from that experience was a sense of gratitude. I think that, traveling to India, I don't know if you and your family went to India, but when I was little, we would go to India every single year. And I think it really gave me a sense of gratitude, which is really important for our mental health, in realizing how much we have, because I think we're always looking for the next best thing.
Oh, we talk about
And
pollution here.
yeah,
Like the pollution in India is crazy. I
yeah.
mean, and the allergies there are crazy.
They are. You're right. You're absolutely right. And I just think that that perspective obviously is something that you get from traveling. And I think it's a really important perspective. And I wish more people in America had it. Only like 30% of people in America have a passport. So I think that's a really important part. And then just how important community is. I think that, I had this experience. It was actually when I volunteered in Haiti after the earthquake. We had a patient that got electrocuted. So it was 7 weeks after the earthquake. So it was after kind of the aftermath of the earthquake and what everyone was dealing with, not having their medication, so all of their chronic illnesses getting much worse. But this particular patient was probably like 18 and he was climbing up to restore electricity for his family, and he got electrocuted. And he was somebody that we were like, you know what? If he gets to the right place, he's actually going to survive, right?
Yeah.
Hillary Clinton's daughter was out there doing like a project where she was taking some patients back to Florida to get care there. So we got him on that list, right? The night before he was supposed to go, something happened to the ventilator and the power went out. Somehow no one noticed it and he died because of that.
Oh,
Okay. And we came back the next day and we were just, the team of doctors, we were like so besides ourselves. We were all crying. We were all kind of like not taking it well because we were just finally hopeful that someone was going to do well, because there's so many patients that were not doing well and were dying. And so the family though came up to me after that and they were like, we don't want you to cry. Like, you actually gave us hope. Like, just having you here and being able to bring him to somebody and not letting him die at home gave us so much hope, and it just allowed them to feel the sense of community, and I
Mhm.
think that that's really what we all need as humans, right? Like, no
Yeah.
matter what we're going through, and all of the longevity studies now are showing that the like, number one
Yeah.
factor in how long you're gonna live is how much community you
Community
have
around.
around you,
Yeah.
right? Like,
Absolutely.
what does your community look like? Like, who do you have around you that's supporting you? And I think that, I saw that even when I was traveling, like, was just not only that people living in communities where, they really had to travel miles and miles, like Nepal was in the middle of nowhere. People were traveling miles and miles with actually a lot of orthopedic injuries
Mhm.
because it's in the mountains.
Yeah.
So, I had this one mom who had a child with Down syndrome who had fallen and broken, and she had carried him, like carried her actually as a little girl, all like miles and miles and miles.
Wow.
And but she had community support too, right? There's
Yes.
people that were helping her along the way. And that's really what we all need, especially right now with everything that's happening. I think that we just really need to hold on to each other and community. And that's really what I take away from everything. I just really hold on to my friends and my family
Yeah.
and everyone around me, my colleagues,
Yeah.
my colleagues are like my family too, right?
And it's as you were talking about before too, with more and more allergies around for adults and children, having the community around that is going to be really important also. Just to have that empathy and to recognize that families are going through something that may not be your lived experience, but is their experience and is very different.
Yeah, and I think, like, you're on social media, I'm on social
Yeah.
media. I think people create community in all sorts of ways, and I think social media, there's a huge food allergy community where people are supporting each other, sharing tips, and, people feel heard, people feel seen, and they feel like there are other people like them, right?
Yeah.
So, community, I think, is super important in chronic illness, no matter what your illness is.
Illnesses.
I think it's just really important to know that you're not alone, whether it's in your chronic illness or whether it's just in daily life that, you have somebody that's supporting you and you have that network of people.
Sure.
Mhm.
Well, this has been amazing. Thank you so much for joining me today. I would love for you to tell our listeners where they can find you.
So I am on social media. My handle is NYC Doctor on Instagram and TikTok. I'm not really on TikTok too much, but and then I'm also on LinkedIn
Okay.
as yeah.
Great. Awesome. Thank you so much.
Thank you.
Thank you for tuning in to the Resilience Factor. If you're ready to build a stronger, longer lasting body, make sure to subscribe and share this episode with someone who's ready to thrive. You can follow me at Dr. Pamela Mehta for more expert tips on strength, recovery, and orthopedic health. Until next time, stay strong, stay smart, and stay resilient.